The other larger one is in the renal pelvis. And entering into the, if you see that it is protruding into the proximal ureter. This is the calculus. Why this is the calculus? From here to here, measuring 18.5 millimeters, a bright, coarse echogenic area. Now you see it is giving posterior shadow. This is black posterior shadow behind it. So this is a calculus in the renal pelvis and then protruding into the proximal ureter. This is the proximal ureter. The proximal ureter measures approximately 5.9 millimeters, whereas it should, the maximum upper limit is up to 7 millimeters. So the proximal ureter is yet not dilated to that, is not dilated. And the calculus is seen protruding from the renal pelvis into the proximal ureter in the region of the, or you can otherwise say a calculus measuring 18.5 millimeters is seen in the region of PELVI ureteric junction, and as a cause of this dilation of all the calyces. So this is the right kidney. This is the third finding in this patient. First was the fatty liver parenchymal changes, second was a gallbladder calculus, and third is this obstructive uropathy with a calculus seen protruding from the renal pelvic region into the, this one, giving shadow, posterior shadow into the proximal ureter, or in the region of the pelvic ureteric junction. Renal pelvic ureteric junction. These curves, when you see and slight dipping of them, this is called dipping sign, and therefore I will say that the degree of dilation is moderate to massive with presently preserved parenchymal thickness, though echogenicity is raised and slightly raised, diffusely raised, and there is slight muffling of the corticomedullary differentiation. So this is a case of obstructive uropathy due to calcula in the pelvic ureteric junction, long-standing, compromising the parenchymal thickness a bit, and with parenchymal changes and loss and relatively muffled, or we can say that loss of corticomedullary differentiation in the right kidney. This is the outer surface of the kidney, this one, and this is the below the capsule, the cortex and medulla. Yeah. So the length of the kidney, how much it measures? The length of the kidney is 13.2, and should not, the normal kidney should not exceed 11 centimeters in length, whereas the patient's kidney measures 13.2 centimeters in length, which is in right diameter. And in anterior-posterior diameter, which is the most important diameter to be considered, the kidney measures approximately